Treatment of gonorrhea. In this video, I'm going to talk about the treatment of gonorrhea. First of all, gonorrhea is a bacterial sexually transmitted infection, and the good news is that it is curable. However, treatment must be complete, correct, and timely. Improper treatment lead to treatment failure, serious complication, and antibiotic resistance. The recommended first-line drug and drug of choice for treatment of gonorrhea is ceftriaxone, which is given as a single intramuscular injection. It is very effective against Neisseria gonorrhea, which is a causative agent of this gonorrhea. This recommendation is based on global guideline because many other antibiotics no longer work against Neisseria gonorrhea. There is reason why ceftriaxone is preferred to other antibiotics. Why ceftriaxone is preferred to other antibiotics? This is because the bacteria Neisseria gonorrhea has developed resistance to many antibiotics, and ceftriaxone still remains highly active, and it reaches high levels in the blood and tissue. It's still effective against genital, throat, and rectal gonorrhea infections. That is why it's still used today. It's very effective, even though when you misuse it, antibiotic resistance will tend to develop. Gonorrhea and chlamydia often occur together, and if chlamydia has not been ruled out, treatment must cover both infections. That is why doxycycline is added in the treatment. So if gonorrhea is treated and chlamydia is ignored, that will be persistent symptoms. That is why treatment must cover both infection. For throat infection or pharyngeal gonorrhea infection, it's harder to treat. It requires strict adherence to the recommended therapy, that is ceftriaxone. So follow-up testing is required here. And also, rectal gonorrhea infection require the same treatment, the same therapy, that is ceftriaxone, and it responds well to the treatment. There is what is called disseminated gonococcal infection. This is when the gonorrhea spreads to the bloodstream. Here, the treatment of this takes longer time. Close monitoring is required in the treatment, and ceftriaxone intravenous injection is used. This is given through the vein, and hospital admission is required. This disseminated gonococcal infection is a medical emergency, so care should be taken. And again, all sexual partners within the last 2 months or last 60 days should be notified, tested, and treated. Treating only one partner leads to reinfection, that is recurrence or infection. After treatment, sexual activity should be avoided for at least 7 days, that is a week. This is to allow the antibiotics to clear the infection, and all partners must be ensured that their treatment has been completed before resuming sex. Follow-up and test of cure is very necessary, although test of cure is not always required in all complicated cases, but can be recommended if symptoms persist, if pharyngeal infection is present, if non-standard treatment is used, and if alternative treatment option is used. That's where test of cure is required. Retesting after few months is necessary. This is to detect reinfection and does not always mean treatment failure. The surprising thing is that gonorrhea has developed resistance to penicillin, fluoroquinolone, and tetracycline. Self-medication is very dangerous. Incomplete dosing is very harmful, and using the wrong antibiotic or wrong use of antibiotic is very risky. That is why you should be careful when it comes to antibiotic, because of developing resistance as tend to occur when antibiotic is wrongly used. Antibiotic resistance is a serious issue. Gonorrhea is considered as a global antibiotic resistance threat. Despite this thing, ceftriaxone is still effective in treatment of gonorrhea infection, and self-medication is condemned here. It's is not recommended. Chlamydia co-infection must be considered in treatment of gonorrhea because both gonorrhea and chlamydia infection usually occur together, and partners must be ensured they are all treated completely. So this is what you should not do when it comes to antibiotics. You should not self-medicate. You should not use leftover antibiotics. You should not stop your treatment early. And you must complete your treatment. You should not rely on herbal or traditional mixtures. Self-medication, use of leftover antibiotics, and incomplete treatment contribute to antibiotic resistance. That is the reason why you should avoid those things. Thank you for watching. If you find this video useful, share to other people. Subscribe, comment, and likes. Keep following. See you next time.